This is the one video you cannot afford to miss. Shoulder injuries are one of the top reasons athletes find themselves sidelined, but understanding the root cause and knowing how to prevent and respond can make all the difference. And so today we're cutting through the noise to give you a clear, detailed look at the athlete's shoulder. From the signs and symptoms to the precision tests used by sports doctors like myself, we'll cover everything you need to know on how to protect, optimize one of your body's most crucial joints. If you're serious about sports, this is the one video you cannot afford to miss. What's up, guys? If you're new here or don't know me, my name is Dr. Cam and I'm a double fellow and residency trained in sports, orthopedic, spine, and manual physical therapy, and I teach also in a doctorate of physical therapy program. On this channel, I provide you strategies and tools to get you to throw hard and stay healthy. Shoulder pain can drastically impact an athlete's career. A thorough initial assessment is so critical, and let's just start with the basic anatomy of the shoulder and why it's so susceptible to injury. Now let's talk about subacromial impingement, or SAI, a little acronym for it, which is a common source of shoulder pain actually in everyone. First up, we have the Neer sign test. As you watch this video here, this test checks for the pain when we elevate the arm like this, indicating impingement. To perform this test, we want to passively take the shoulder into full flexion while maintaining internal rotation, looking for pain. If there are no reproduction of symptoms, do this motion again and add an overpressure by placing one hand on the scapula, the other in the axilla or the armpit near the glenohumeral joint, and apply an overpressure into flexion and adduction. A positive test is simply reproduction of symptoms. The next test we're going to go over is actually called the Hawkins Kennedy test. To show this test, with the arm elevated and bent, internal rotation like this can also show signs of impingement. So we want to passively take the patient's arm into flexion and horizontal adduction, stabilize the top of the shoulder, and internally rotate the humerus, looking for available range and reproduction of symptoms. You want to compare that to the opposite side. A positive test is limited range or pain in the shoulder. Rotator cuff issues are next. The Jobe test, or the empty can test, is a crucial one here. For this test, we want to elevate both arms to 90 degrees and scaption with the thumbs up for the full can position. Apply resistance to bilateral arms, looking for any reproduction of symptoms or lack of strain. Next, internally rotate the patient's shoulder so their thumbs are now pointed downwards for the empty can position. Retest the strength in this position. A positive test would be a decrease in strength or an increase in pain in the empty can position versus the full can position. By resisting the arms in this position, we can assess for weakness or pain in the supraspinatus muscle. Another important test would be a painful arc test. This is really just a test to see when the patient elevates their arm between 60 and 120 degrees during arm elevation, do they have pain? That can help indicate subacromial impingement and rotator cuff problem. Internal impingement often affects athletes who use overhead motion. The apprehension test and the relocation test is very telling. Now, if elevating and externally rotate causes discomfort or fear, that's when the relocation test comes in. And if the fear and pain goes away, that's actually a positive relocation test. So let me explain both tests. The patient's elbow is flexed to 90 degrees and abducted to 90 degrees. You want to rest the athlete's shoulder on your thigh if you are the therapist. The clinician or the therapist then palpates the anterior shoulder while taking the shoulder into external rotation. A positive test in apprehension or fear is that the clinician moves the patient's arm and they know apprehension or fear. Now the clinician would then proceed, apply a posterior glide to the shoulder. If the fear and pain or apprehension reduce, again, like I said, that's a positive test. Now, if you want to scare the patient, release that posterior glide, and then fear and apprehension or pain should reoccur. Now, for general shoulder instability, the sulcus sign is essential. And what we want to do is we want to measure in centimeters the distance between the inferior surface of the acromion and the superior portion of the humeral head. I actually have this on my right shoulder, my non-throwing shoulder, because I've dislocated it many times. So to perform this test, we can either perform it in supine or standing, and we want to place the shoulder in 20 degrees of abduction and in forward flexion while maintaining a neutral position. And we want to pull down on the arm like you see in the video. If you see a gap between the humeral head and the acromion, that's a positive test for instability. The loaded shift test further defines the type of instability. So with one hand, stabilize the scapula on the thorax, while the other hand palpates the humeral head like you see in the video. Add a compressive force through the humeral head in an anterior and posterior direction, assessing for movement. Normal, the humerus moves anteriorly a distance equal to about half the humeral head. Positive test is any distance more than half the humeral head anteriorly. By pushing the humeral head anteriorly and posteriorly, we truly assess for abnormal movement. Labral tears and bicep tendon issues are serious. The speeds test checks for biceps tendon integrity. Flex the patient's shoulder, the athlete's shoulder to 90 degrees and maintain the palm up position. Add resistance to the distal forearm while palpating the biceps tendon. Look for reproduction of symptoms at the biceps tendon. By resisting arm elevation like this, pain in the front of the shoulder suggests biceps issues. The O'Brien test helps identify labral tears. So instruct the athlete or patient to raise their arm to 90 degrees and then 10 degrees of horizontal adduction and maximum internal rotation. Apply a downward force to the patient's arm, looking for reproduction of symptoms. Have the patient maximally externally rotate the arm and repeat that downward force. A positive test would be symptom reproduction when internally rotated and a reduction or absence of symptoms when externally rotated. One disclaimer is AC joint pathology is indicated if the patient reports the symptoms are on the top of the shoulder, whereas labral pathology is indicated if the patient reports pain inside the shoulder. Pain on this motion with the arm pronated but not supinated or externally rotated indicates a slap lesion. Woo! We covered a lot. From diagnostics to understanding various shoulder pathologies, each test we perform gives you invaluable insights into the health of your shoulder, guiding us toward the best treatment path. One thing I ask from you is if you share this with others who might benefit from knowing more about shoulder health. Drop any questions or comments below and I'll be sure to answer those back. Stay tuned for so much more content designed to help you stay above your game. And just remember, I'm Dr. Cam and I got you.